Hi, I'm Dr. Mike Cedars. Let's talk about breast augmentation. When women come to see me about breast augmentation, they usually have a sense of what they want to look like. They will commonly describe it in terms of cup sizes, sometimes not, but they always have an idea of how they'd like to look. In my practice, I find the large majority of women want to be somewhat larger. I rarely see women that want to have very large breasts. Nevertheless, how do we determine what size implant to use? As I mentioned a moment ago, I find that cup size is not a helpful way to discuss this because the bra manufacturers don't agree among themselves as to what's the actual breast size that corresponds to, say, a 34B or a 36C. So instead of using that, I like to direct women to 3 techniques of giving me the information that I need to be able to make recommendations for them. The first, and perhaps most helpful, is from looking at photographs. Priscilla in my office has put together a booklet of breast photos of all shapes and sizes, and I will give a woman this book and a stack of Post-its and a pen and ask her to go through and tell me what she likes. This is too big, this is too small, this is just right. It's sort of the Goldilocks approach. And additionally, what else she can tell me about the appearance. Now, obviously, we're not going to take this breast from the photograph and paste it onto our patient, but what we're looking for is a sense of the balance between the breasts and the torso. In addition to actual size, women will have preferences in terms of how close together or far apart the breasts are. Also, what is the shape of the upper pole of the breast? Some women like a very natural look where on profile the upper pole of the breast is fairly straight. Some women like a look where the upper pole is actually bulging out or convex. It's a look that normally is present only in very young women, but some women really like this look. On the other hand, some women particularly dislike this look, and it's really helpful for me to know ahead of time what they're looking for so we can try to accommodate them. The second thing we use is I will make some measurements. We'll take a tape measure and measure how big around the chest wall is. I will measure some of the physical characteristics of the breast tissue itself, how much give there is. Does it tend to sag at all? A woman who's 20 who's never had children will have, in general, tighter tissues, and that means there's less room for me to put an implant in. On the other hand, a middle-aged woman that has had several children will have looser tissues, and that gives us more options. It doesn't mean that she necessarily has to use a larger implant, but there may be more room for a relatively larger implant if the woman wants that. The third thing I use is probably the least reliable, but it is helpful, and that is we have jogging bras in the office, and we will ask the women to put them on and let them try actual breast implants of different sizes that they can place against their skin within the bra, and then if they wish they can try on different tops to see how they look in these different tops. And of course, the look is not exactly the same as how things look when we take the same breast implant and place it in the tissues, but it gives us a ballpark estimate. And then from taking these 3 different ways of looking at implant size, I can make my recommendations to the patient. Hopefully all 3 of them point in the same direction. If there's some significant discrepancy, then we have some talking to do before we decide to go ahead with the operation. For most women, the recovery is such that they're able to be back at work at 1 week. So, thanks for listening. This is Dr. Mike Cedars. Take care of yourself.